Depression in the elderly is one of the most overlooked mental health issues in society today. As people age, physical health often becomes the focus of attention. Blood pressure, heart conditions, arthritis, diabetes, and mobility challenges. But behind these visible concerns, emotional struggles often remain hidden. Many older adults suffer from depression, yet their symptoms are dismissed as just getting old or part of aging. This misunderstanding prevents them from receiving the emotional support and treatment they truly need. In this video, we will explore the symptoms, causes, risk factors, and solutions for depression in the elderly, helping families and caregivers recognize the signs and respond with empathy. One reason depression in older adults is difficult to identify is that its symptoms look different compared to depression in younger people. Instead of showing obvious sadness or crying, elderly individuals may display irritability, fatigue, apathy, or confusion. They may complain about physical aches rather than emotional pain. Because the body naturally changes with age, these symptoms are often misinterpreted as normal aging or physical decline. But depression is not a natural part of aging. It is a mental health condition that affects how seniors think, feel, and function. A hallmark symptom of depression in the elderly is loss of interest. Activities that once brought joy, gardening, reading, cooking, walking, social gatherings, may suddenly feel meaningless. A senior may stop leaving the house, withdraw from family events, or give up hobbies. This withdrawal is often mistaken for tiredness or lack of energy, but it is actually emotional disengagement. Over time, the lack of stimulation worsens depression, creating a cycle of inactivity and sadness. Memory problems are also common in elderly depression. Many older adults experience cognitive decline naturally, but depression can worsen these symptoms or mimic dementia, a condition known as pseudodementia. Seniors may forget names, misplace objects, repeat questions, or struggle to make decisions. These changes can be frightening for both the individual and their family. Without a proper mental health evaluation, families may assume the senior is developing Alzheimer's or another form of dementia, when in fact, depression may be the underlying cause. Physical symptoms are another key indicator. Many older adults with depression experience chronic pain, such as headaches, back pain, or stomach discomfort, that has no clear medical explanation. They may experience changes in sleep patterns, such as insomnia or excessive sleeping, both of which worsen fatigue. Appetite changes are also common. Some seniors lose interest in food and unintentionally lose weight, while others may overeat out of boredom or emotional distress. These physical signs often bring seniors to doctors, but unless mental health is addressed, the emotional root of their suffering remains untreated. Loneliness is one of the strongest contributors to depression in later life. As people age, they often lose loved ones, spouses, siblings, friends, creating deep emotional wounds. Losing a life partner after decades of marriage can be especially devastating. The home may feel empty, routines become unfamiliar, and the sense of identity built around the relationship becomes shaken. Retirement can further intensify loneliness. Without daily social interaction or work responsibilities, seniors may feel disconnected from society. If they live alone or far from their children, the isolation becomes even more severe. Loss of independence also contributes to depression. Many elderly individuals struggle emotionally when they can no longer drive, work, or perform daily tasks without assistance. Simple activities like climbing stairs, cooking, or managing finances become difficult. The loss of independence creates feelings of inadequacy, helplessness, or shame. Seniors may believe they are becoming a burden, even when their families are willing to help. This belief can deepen depression and prevent them from asking for the support they need. Chronic illness is another major risk factor. Conditions such as heart disease, arthritis, diabetes, Parkinson's disease, and chronic pain disorders take a toll on both the body and the mind. Frequent doctor visits, medication side effects, and physical limitations contribute to frustration and emotional decline. Depression often worsens chronic illnesses, creating a painful cycle. Poor mental health reduces motivation to manage medical conditions, while worsening physical symptoms amplify emotional distress. Financial stress is another contributor. Many elderly people live on fixed incomes or pensions, which may not cover rising medical costs, daily living expenses, or emergencies. Worry about financial security causes anxiety, sleepless nights, and emotional strain. When finances are unstable, seniors may feel trapped, powerless, or worried about the future. Despite the seriousness of depression in the elderly, many do not seek help. Stigma plays a role. Older generations were often taught to hide emotions and stay strong. They may see depression as a personal weakness rather than a medical condition. Others may not recognize their symptoms as depression, believing sadness, loneliness, or fatigue are simply part of getting older. This leads to silent suffering. Recognizing the symptoms of depression in the elderly is the first step toward treatment. Families, caregivers, and healthcare providers play a crucial role. If an elderly loved one becomes withdrawn, loses interest in activities, expresses hopelessness, shows cognitive decline, or struggles with unexplained physical symptoms, it's important to seek a mental health evaluation. Depression can be treated successfully through therapy, medication, social engagement, lifestyle adjustments, and community support. Therapy, especially cognitive behavioral therapy, helps seniors reframe negative thinking patterns and develop coping strategies. Medication can help balance brain chemistry, particularly when depression is moderate or severe. Social connection is essential. Encouraging seniors to join clubs, attend community events, participate in senior centers, or reconnect with friends helps reduce isolation. Physical activity, even light walking or stretching, improves mood by increasing endorphins. Maintaining a regular routine, eating balanced meals, and getting proper sleep also support emotional stability. Family support is especially important. Spending time with elderly relatives, listening without judgment, offering reassurance, and helping them feel valued can dramatically improve their emotional well-being. Small acts, visiting regularly, sharing meals, calling often, encouraging hobbies, make a powerful difference. Seniors need to feel loved, respected, and included. Finally, it is crucial to remember that depression at any age is treatable. The elderly deserve the same compassion, attention, and mental health care as younger generations. Aging does not mean giving up on joy, purpose, or emotional fulfillment. With understanding, proper treatment, and strong support, older adults can overcome depression and regain a meaningful and satisfying quality of life.